Very good morning to you once again. If you're just joining us, South African health workers were the first to get Johnson & Johnson COVID-19 vaccine. They were part of a coordinated Johnson & Johnson trial by the Department of Health and the South African Medical Association. So far, the government has managed to secure 160,000 doses of the Johnson & Johnson COVID-19 vaccine. Joining us now to share her experiences of how the vaccine went is Dr. Nosipho Mhlanga, a medical doctor who works at one of South Africa's biggest hospitals. Dr. Mhlanga, firstly tell us exactly where you work before I get into the nitty-gritties about the J&J vaccine.
Good morning, Xoli. Thank you so much for having me. So I work at Chris Hani Baragwanath Academic Hospital. That's where I'm stationed. I'm doing my second year of internship.
Aha. And it's one of the massive hospitals in this country, in fact, on the southern tip of the continent. How were or did you experience any side effects after being inoculated? And when was this that you received the vaccine?
So with vaccinations in general, and this is the experience that I had with my vaccine, when you do get your inoculation or your injection, I mean, it's natural. It's painful because it's an injection that's going into your arm. So immediately when you get the jab, it is quite painful, and the vaccine itself burns a little. So for a few hours after that, maybe to a day or two, your arm may be really painful. My arm felt quite heavy and I struggled to move it for a while, but those symptoms subside after a few hours. And with COVID generally, I had COVID-19, the different variant, in August of last year, and it's been noted that people who have had COVID before, their symptoms come a bit earlier. So between day 0 to day 2, you start experiencing symptoms and they may be more severe. And the people who haven't had COVID before get their symptoms around day 3 to 4, and they're not as severe. So with me, the side effects that I ended up experiencing on day 2 was extreme fatigue. I felt really tired. I couldn't move my body. It felt very similar to how I felt when I had COVID before. And I also had a headache. But with just some Panado, that went away quite quickly, so the symptoms didn't last longer than 2 days. But those are the main side effects that I personally experienced. Other people did have the nausea, the vomiting. I didn't have that, but there is a range of symptoms, but they're quite similar.
Yeah, very interesting that you mentioned you also had COVID-19. Did you at any point or at any stage become reinfected with this virus?
No, I haven't. So I did do a COVID test, I think, about a month ago, and that swab was negative. So since August, I haven't been reinfected. All
right. So how long does it take then to build immunity after being inoculated?
So from the studies that they've done, it shows that around 7 days, you start developing immunity against severe disease. So the form of the disease that could possibly land you in ICU or kill you. After about 7 days, you have immunity against that. And then about 10 to 14 days is when your body builds the general immunity that will protect you against the moderate to severe disease as well. So it's about 10 to 14 days, earliest 7, and then your body builds immunity until about a month after your vaccination.
Yeah, some people asking the question, after getting a vaccine, would your fertility be affected as a woman?
So I can understand why that's a significant question, because fertility is really important and a lot of people struggle with fertility. And the reason why there's a discussion around the COVID vaccine and fertility is because there's a certain protein. So the way that they're making this COVID vaccine, the Johnson & Johnson one, they've used a virus called adenovirus, which is a virus that usually causes the common cold, diarrhea, and some eye conditions. And it's a very malleable vector. So they were able to take the adenovirus and put the spike proteins that are reflected on COVID-19 onto that adenovirus. So the reason why there are the discussions around fertility and the COVID vaccine is because those spike proteins that they've put on the vaccine are very similar to another protein that's called syncytin-1 that is in your uterus. So what this protein does is it helps the placenta bind to your uterus and makes a nourished placenta for a viable pregnancy. So because they're similar, the thing that people are saying might be a problem is the antibodies that you develop against COVID-19 when you're exposed to the vaccine, they think that they'll go and cross-react with that protein in your uterus and maybe make it challenging to carry a viable pregnancy or cause you to be infertile. And because of how genetics work, for things to bind to each other, they have to be exactly the same. And the spike proteins of COVID-19 and the syncytin 1 are not exactly the same. They're not identical. So those antibodies have no way to go and bind to your uterus. So it's unlikely that you're going to get infertile from the reaction that you'll have with the antibodies, because no reaction can occur because those two specific proteins are not identical. Yeah. So it's unlikely that the COVID vaccine is going to cause anyone to lose a pregnancy or even worse, become infertile. Yeah.
Perhaps as a final question to Doctor, we've already mentioned that you work for one of probably the busiest hospitals on the southern tip of Africa. As a medical doctor, it's almost a prerequisite that your non-pharmaceutical interventions, washing hands, yes, sanitizing and wearing a mask, that's a must-have or a must-do. Yes. Have you noticed any behavioral change at a personal level now that you've received a jab? Has your behavior changed in terms of you thinking, for example, that, I don't really need to be as stringent with these non-pharmaceutical interventions away from your work, in your personal space now, whether it be at home or you're out shopping? Yeah.
So I think the challenge with COVID-19, and I think COVID fatigue is a real thing, is that over time with us dealing with this pandemic for so long, a lot of people have just gotten out of the routine of doing those safe practices. But one thing that is very much stated with the vaccine is that even though you've been vaccinated, those safe practices don't go out the window. And on a personal level, as you've mentioned, at work, it's mandatory for us to continue with those safe practices because we did them even before COVID-19. But on a personal level, I still do try to make sure that I keep myself and my space as sanitary as I possibly can, because I do live at home with my family, and my mom and my aunt both have hypertension. So even though I've gotten the vaccine, they haven't. So if I'm unsafe in my practices, then I can expose them to any possible infection that I may carry. Because the vaccine doesn't necessarily mean you'll never get COVID again, but it will definitely protect you from the severe to the moderate to severe to the severe infection. So if I am carrying a mild infection, I can still infect those around me. So I do still try to make sure that I keep up the hand washing, I keep up the sanitizing, and the shared spaces at home. We've tried to limit sharing spaces so that we don't cross-contaminate and so that my family is protected, especially because I live with people that have comorbidities.
Yeah, I wouldn't be doing my job, Doc, if I didn't ask you this particular question. And there has been some resistance among some health workers who say, I'm not going to take this jab, firstly because it's a trial. This is not entirely, it has not entirely passed the process. You know, we don't trust this vaccine. How much resistance has there been among fellow workers at the hospital to taking this jab? Has it been a wholesale take-up of this jab with people lining up and saying, listen, I need to get this thing? Or have you seen some who say, no, for whatever reasons?
Yes. So I think healthcare workers are human beings just like everybody else. And even though we work in the healthcare environment, we all have our own biases. And there have been some people, even myself included, before I got the vaccine, when because we had different vaccination days. When I heard about my colleagues who were reporting the side effects they were experiencing, obviously it caused some anxiety because you're concerned that, well, might this end up turning out badly for me? What if I have worse side effects? What if I have adverse effects? It's natural to be afraid of something that's new. But I think the important thing to understand about vaccination, and I think it's because COVID is new, which is causing all of this drama, vaccines have been in the works for years. We use vaccines all the time. Almost every child in this country gets vaccinated. But the reason why people trust those vaccines or don't ask questions about them is because they're tried and tested vaccines that were developed over many, many years. And we haven't lived through pandemics because we have vaccines. And unfortunately, COVID being new makes it a lot harder because you are at where the pandemic is starting. You're where the vaccine is starting. Whereas throughout our lives, we were getting the vaccines way past those pandemics. But it's important for everything to start somewhere. The smallpox vaccine started somewhere. The TB vaccine started somewhere. Unfortunately, we're in the wave where the COVID vaccine is starting with us. And I think it's very important to consider that COVID-19 still does kill, especially this new variant that spreads a lot faster, that kills a lot faster. I've had a lot of people around me who have lost their loved ones due to this new variant of COVID. So I think even though it's scary that the vaccine may be new, it's also important to understand that the benefits way outweigh outweigh the risks because it's been tested, it's been tried, and yes, it's not completely approved, but they're not giving us a vaccine that they haven't trialed on anyone. It's been shown to be effective against the South African variant that we have, so it is effective. And even though it's not licensed yet, it's safe to use. So I think people shouldn't be afraid of getting the vaccine because they wonder what will happen to them when they get it, because the studies show that it's not much except for the mild side effects. And also, it's better for you to be protected so you get the form of COVID that's milder and definitely not the form of COVID that will kill you. So healthcare workers are afraid, and to be honest, the turnout at our hospital was brilliant. The majority of people got vaccinated, no questions asked. And even myself included as an example, I was afraid, but I still got the vaccination because I knew that the benefits for me way outweigh the risks.
Oh, Doctor, you've convinced me, and I've been saying this to a number of my interviewees who have been very, very speaking highly of this Johnson & Johnson vaccine. So thank you very much for sharing your experiences with us. And best of luck with your job, and stay safe as always. All right, Nosipho Mhlanga, she is a medical practitioner at the Chris Hani Baragwanath Hospital.